Hi there, and welcome to my channel, Surviving Cancer During a Global Pandemic. Today I thought I would walk you through what to expect at your first infusion and how to prepare, what to bring with you, and what to pick up ahead of time. And this talk is specific to FOLFOX and FOLFIRINOX chemotherapies, which are primarily used to treat colorectal cancers. So I will touch on some of the side effects, but it's such a big topic that I have a separate presentation on the side effects and tips and tricks for dealing with those. So check that out if that's interesting to you. I am a stage 4 colon cancer patient at the moment. I've been through 6 rounds of FOLFIRINOX and 4 rounds of FOLFOX. So once you get diagnosed with cancer and start going through chemotherapy, everybody starts asking you a lot of questions about, like, what's cancer? Why do you get side effects? So I just like to touch on at a very high level. You can tell your friends and family, because they're going through it too, that, basically cancer is the uncontrolled growth of what we call abnormal cells in the body. They're not cells that we want in the body because they don't function correctly, and they divide really quickly and continue to create new cancerous cells, which create the tumors that cause the problems. So chemo drugs attack these rapidly dividing cells in a variety of ways. So that's why they use multiple types of drugs, because some drugs attack, for instance, the cell walls, while other drugs may attack the genetic material inside the cells. So by going at it in multiple ways, it gives you a higher success rate on shrinking your tumors. But when you do go through chemotherapy, the chemo drugs can't differentiate between bad cells and good cells. And some of our good cells are in, like, hair follicles, our skin, the lining of our mouths, your whole gastrointestinal tract lining. And this is what creates the side effects. So it's something that can, unfortunately, you just can't say, hey, target just the tumor in my liver, for instance. It goes systemically throughout your body. So talk to your doctor if you're having side effects as well, and make sure that you keep him up to date on what's going on with you. So let's talk a little bit about the FOLFOX and FOLFIRINOX chemotherapies and what's the difference between them, and why are they called FOLFOX and FOLFIRINOX. So FOLFOX is the combination of 3 different drugs. You have one that's called leucovorin, or folonic acid, and the other one is fluorouracil, or 5-FU, and then the third one is oxaliplatin. So these 3 things together attack the cells in different ways. Oxaliplatin, for instance, attacks the cell walls. I know that one specifically. Then FOLFIRINOX builds upon, if you will, the FOLFOX 3 different drugs, and adds in a drug called irinotecan. And this one has been shown to be very effective on shrinking tumors, but irinotecan is I think a lot harder on the system than the FOLFOX by itself. So talk to your doctor about, which one that he thinks is best for you. But I did find, that with the FOLFIRINOX, it shrunk my tumors a lot. And then they did the FOLFOX later to kind of touch up chemo for me. So both FOLFOX and FOLFIRINOX have to be administered intravenously. So I opted to have a power port surgically implanted in my chest, and the power port itself is threaded into one of the big veins in my chest. So this is what every time that the nurse will pierce the skin with a needle, and all my chemo goes through this area. So I don't have to get any IVs put in, stuff like that. So the power port is, like I said, surgically implanted underneath the skin in the chest. It's an outpatient procedure. This picture was actually taken the day after my procedure, so you can see it's not a big deal. Very small incision, no sutures. They just use the dermaglue to glue it shut. It's completely under the skin, which is nice because there's less risk of infection. And it can be used, they told me, for blood draws or contrast during my MRIs. But just note that a lot of nurses aren't trained to use the port. So I find that I only get my port accessed for chemotherapy. So, and something that they didn't tell me, I just found out, is that if you're taking a break from chemo or you're done and they're just leaving the port in just in case, God forbid it comes back. But if it's not actively being used, you do still need to go in every 6 weeks and let them flush it out to make sure that it stays good. And you don't want to have to, get your port redone. So let's talk a little bit about the days leading up to the infusion, and this you'll get into a regular cadence with your infusions. But 2 days prior to chemo, they will always have you go and get a blood draw, labs run, and this is to make sure that you're feeling okay and that you're healthy enough to take chemotherapy. 1 day prior, a nurse will call you and walk you through a checklist of questions. Again, all of this is designed to make sure that you're feeling well enough and that you've recovered from your last infusion and you're ready for your next one. You definitely want to purchase some over-the-counter drugs to deal with some of the side effects. So for constipation, they recommended for me Cinecote, Miralax, and Colace. And I used them in I just kind of tried them and saw which one worked for me. And then you'll need Imodium for the opposite problem of diarrhea. And then if you don't already have a lightweight pair of gloves, I would purchase a pair. Don't spend a lot, just something really inexpensive, because one of the worst side effects of oxaliplatin is cold sensitivity, which we'll talk about in a minute. And then your doctor will prescribe you a couple of prescriptions or maybe 3 prescriptions for different types of nausea medicines. So I don't know about you, but whenever I thought about chemotherapy before I actually went through it, I pictured, myself throwing up constantly for weeks. But they really do not want you ever to throw up, and they don't want you to feel nauseated, and they definitely want you to eat. So they've come a long way on drugs that can help prevent this, so you should not have to worry about that. So you'll pick up your nausea prescriptions ahead of time, and you'll take them the day of the infusion itself. So what to bring with you to chemo on your first day. So it's your first day, it's your infusion day. Definitely bring a bag with you and pack it with, like I said, lightweight gloves are great for oxaliplatin. A scarf too, if it's cold outside or, you're getting blasted with air conditioning. Definitely bring some snacks. They will have snacks there, but I always want something that is a little bit, specific to what I want. I always brought myself, for instance, a hot beverage and some like cheese and crackers. So you'll want to bring something to pass the time. These days are long. So it's either 4 to 5 hours if you're on FOLFOX or 6 to 7 hours if you're on FOLFIRINOX. Definitely bring pen and paper for notes and questions. You're going to meet with a variety of people during your infusions usually. So your doctors, your nurses, social workers, palliative doctors, they all come and, chat with you during this time so that you can make the most of this time and not have to come back for doctor visits. Of course, you need your ID and insurance card, and they will insist that you have somebody to drive you, and you will definitely not want to drive yourself. So let's talk about infusion day, day 1 of chemo, and what it looks like and what. So when you get there, at least in the cases that I've seen, and I've talked to a few other folks as well, you check in, and they're always going to weigh you that day because your chemotherapy is tailored for the weight for that day. Where I went, it was private rooms. You don't have to share a room with anybody. You're not out in the big, area with everybody else getting chemo together. There's TVs. They bring you warm blankets if you want. The comfy chairs have massage built into them. They recline. They have snacks that are both cold and room temperature snacks. And in our case, we had room service available because if you're there for 7 hours, you're there for a couple of meals. So they try to make it as pleasant as possible. because they realize, it's a long day for us. So let's talk about what this day looks like. So when you arrive, you settle in, get your, jackets off and everything. And the first thing they're going to do is make sure that you go ahead and take your pre-meds for nausea. So they take 30 to 40 minutes to take effect. So immediately they'll give you these. They're just pills. In my case, they would give me dexamethasone and ondansetron in pill formats, and you swallow these and, just sit there for a few minutes and wait for them. And during that time, they also will access your port. And this is basically, they take, a needle that is attached to IV lines. And so just one stick, and then you're done for the rest of the day as far as sticks is concerned. And they tape that down securely. If you want to, my doctor prescribed lidocaine cream for me. And so an hour before, I would put a glop of lidocaine on there, and then you don't even feel the stick, which is kind of nice. And of course, in the background, your chemo drugs are being ordered and prepared in the pharmacy specific to your weight on that day. So after 30 minutes, your pre-meds are there, so you're ready. Your nausea is not, you're not going to be nauseated. And they start to drip in the first two drugs, which is usually oxaliplatin and the leucovorin together. And this is also when your doctor or your PA or your social workers or various folks may come by and visit you. And this is kind of nice because, again, like I said, you only have to come in once and you get to see everybody. And usually this takes about 2 hours for this specific cocktail to drip in intravenously. And during that time, your nurse comes in and makes sure that you're feeling okay, and if you need anything. Then after the oxaliplatin and leucovorin are done, your nurse will prepare for you your pump. So the 5FU is dripped in over 46 hours. So they don't make you stay there in the hospital, thank goodness, for 46 hours. They give you a special pump, which is attached to you 24/7 for 46 hours. I chose to carry mine around in a little fanny pack. They also have these belts that go around your waist to keep it secure. And you just get kind of used to that. And then it's time to go home. And again, this is FOLFOX, 4 to 5 hours. And it's, it's not too bad. If you're on FOLFIRINOX, it's similar. It's just that you have the extra drug, the irinotecan, which also has to drip in for over 2 hours. So they may at times also push atropine to prevent your stomach from cramping with the irinotecan, which I had mine split up over 2 doses, and it worked great. So during your infusions, I didn't feel much different other than the cold sensitivity would start up, and I would have to watch what I touched. Even things like washing your hands, you can no longer wash your hands with cold water. The cold sensitivity feels a bit like you're getting burned. So, and in some cases, if you go outside and it's cold outside and you breathe in, it could feel like needles in your throat. So that's the weird oxaliplatin side effect that does go away after a few days. But for those first few days, wear gloves, drink warm beverages, and don't touch stuff if you can possibly avoid it that's cold. So day 1 of chemo for FOLFIRINOX is 6 to 7 hours. It's a very long day, and you will be very tired. So once you get home, they'll give you, directions on what to do. Day 2 for me, I felt pretty normal because you're taking your nausea meds, which one of them is a steroid, so it makes you kind of hyped up, and it kind of combats the fatigue that you might be feeling. If you're on FOLFIRINOX, you probably will have diarrhea within the first 24 hours, and then you'll get it again. So that's why you need that Imodium on hand to combat that. I will say that day 2, because you're on the steroids, you also might be kind of sweaty. You might have difficulty sleeping. So that's all the steroids, just so you know. Day 3 is the day that you get your pump taken off. I actually would go back to the hospital and get my pump taken off. And it just gives you an alarm when it's done. And when you go for your pump detachment, it's like a 5-minute appointment. They flush the port side out with saline. They give you a quick heparin injection, again, through the port to prevent clotting. They pull the needle out, put a Band-Aid on there. You're good to go. This is the day for me every time that I started getting really tired. The fatigue started kicking in. And then talk to your doctor on the first 6 infusions that I did with FOLFIRINOX. They actually gave me Granix shots for 7 days, and this was to boost my immune system. And they didn't do that the second time. So I think it just depends on how your blood work looks and how you're feeling. And so talk to your doctor. They may give you those. And basically those Granix shots, just you do it yourself. You self-administer them into your belly or into your arm. And you do that for 7 days on each cycle. My energy levels pretty much followed this path every infusion. So day 1, I was a little tired when I got home. Day 2, I felt pretty normal because of the steroids. And then day 3, it would start to really plummet and my energy levels would drop. Day 4 and 5, I was definitely out. I was in bed most of the time. I slept most of the days. And then slowly, day 6 and 7, I returned to pretty much normal energy levels. And then you have an entire week to recover before your next infusion. So I'll close this out and say that, I hope this has been helpful and preps you for your first infusion. Definitely, if you're the type of person that likes to know more about, specific things, your drugs or specific drugs, check out ChemoCare. It's a website that has detailed information on each of the drugs in FOLFOX and FOLFIRINOX. The Colon Cancer Coalition has helpful information on a variety of topics. And of course, your best source for information is your doctor. Don't suffer in silence. Don't, not ask, definitely ask a lot of questions. And have your partner or your spouse or your friend that goes with you also ask questions as well. So take care, warrior on. I wish you all the best and healing thoughts. And I hope this was helpful. Thank you.